what is one bold change you hope to see in women's health systems globally?
Every country would have a policy that specifically addresses investment case into women's health, because if it starts at government level, then it's downstream and it becomes easy, and it doesn't have to work upstream, because currently we have to advocate for our own health, and trying to scream at the top of our lungs and get people to believe us is a really, really difficult job. I bet everyone here can put up your hand and say yes. I've been trying to advocate for my health and convince people it's an investment case into women's health. So every country would have a women's health related policy, from a menopause level to a menstrual policy.
I would want us to move from women's healthcare being a niche to actually being a core pillar of healthcare. And ideally that would mean that we would have a Minister of Women's Healthcare, which shows that we are moving in the right direction. So we're very much aligned.
I think we want good quality health data, including the data of women, and that means having women actively involved in research relating to health.
For me, it's easy. If the government don't want to give us 480 days for each baby, it's okay, we can go for 400.
In 10 years' time, I really hope that we as women would have slowed down enough to actually bring care and the qualities that are needed from us as women leaders into those systems. And in the world of technology, there's the risk that it won't happen and we will dehumanize our health system.
Another thing, I would love the day when there is actually going to be, when you sit in front of your HR, you are a new person, you are being onboarded, and she asks you, what is your menstrual cycle?
So you know, in the morning before you decide what clothes you're going to wear or what clothes you're going to put on your kids, you kind of use this tool that tells you the weather outside, that determines how much product I need to put in my hair, or else it'll be fuzzy. I'm inspired by Chelsea's hormone literacy. Like, imagine if it was just as easy to know exactly what the state of the hormones in your body are, which affect everything. Your work, how you're going to parent, how you're going to show up as a spouse, that we were able to do that easily, just like we did with the weather.